Hey everyone, thanks so much for joining today. We are going to be talking about all things Sculptra and just letting you guys know why we love Sculptra so much here and how it can really slow down the aging process. In the bottom right hand corner of the screen, you can see there's a little question box. So if along the way you have any questions that you want to ask before you forget, you can pop it into that question box and I will answer those live at the end. All of the questions remain anonymous, meaning only I can see who's asking them, and no question is a bad question. So if there's anything that I missed or any additional questions you have, just pop it there. So I will talk to you guys in a second. Hi everyone, thanks so much for joining me today. We are going to be talking all about Sculptra and why I love Sculptra so much. So Sculptra is something called PLLA, which is poly-L-lactic acid. It's a biostimulator and it stimulates collagen 1 and 3. Sculptra's been around for about 15 to 20 years. It was originally brought to market for AIDS patients who needed global volume restoration. It was delivering beautiful results, giving fullness all over the face, and it was ultimately brought to the cosmetic industry. It has been a game changer in regard to that global revolumization. Right now, we have had our hands on gel fillers for a very long time. Gel fillers are something made from hyaluronic acid, which is a molecule very similar to the molecules that our own body makes. But gel fillers are short-lived. They last about 9 to 12 months. Some do last 18 months. And they are viscous. So depending on where we're putting them in the face, some are a little bit more firm to give that support and lift. And some are thinner so that they're more dynamic when you animate and express in the lower face. Gel fillers are great when we need to restore volume in a very specific place, where Sculptra we use to put volume back everywhere. We all know that people can be overdone with gel fillers. So if patients need a significant amount of volume restoration due to aging, collagen loss, marathon runners, and we put a ton of gel filler where we need to put volume back, patients start to look pillowy and round and a little bit puffy, which is why Sculptra is always a great option. So Sculptra, we really flood the entire face. It's like spreading little seeds of grass, and that will stimulate that collagen regrowth. Sculptra is an injectable. It comes in a powder form. We reconstitute it or mix it up in sterile water, a little bit of lidocaine. We inject it all over the face and then we wait. It takes about 6 months for Sculptra to really take effect, full effect, and then we maintain with about 1 vial per year. The reason why Sculptra gives such natural, beautiful results is because there's no reaction from friends or family members saying, what did you have done? If they're seeing you day to day or week to week, it's such a gradual, slow process that occurs over a much longer period of time. Sculptra also lasts a very long time. When it stimulates collagen, that collagen regrowth that we get can last an upward of 5+ years. We don't even actually really know how long that collagen hangs around for. And then, the original product that's injected, we say, that lasts, all studies have shown about 24 to 36 months. So it really is giving you a longer lasting result. Sculptra, a full correction, is approximately 1 vial per decade. So if you're 40 years old, you can expect to need 4 vials for a full correction. If you're 50, you can expect that you'll need 5 vials for a full correction, and so on. How we inject Sculptra is an initial presentation. We typically will inject about 2 vials. and then we wait about 6 weeks, and then we inject another 2 vials. And then I personally like to wait 6 months just to see where patients are at that point and decide then, maybe if you're 50, do you need that 5th vial, or are we good and I'll see you in a year? So that really is to be determined by the provider. Sculptra should be the foundation of everything that people do. We also know that Sculptra helps with bone breakdown. We know that it helps with muscle integrity in the deep layers of the muscles. We know that it helps with the dermis. Patients get this beautiful Sculptra glow, which people tend to see, within 3 months or so. And we can add fillers on top of Sculptra if we want to. Obviously, if patients want to augment their lips, or if they do want a little bit more of a pop in their mid-face, we can definitely use fillers on top of Sculptra. But Sculptra is going to be the foundation of anything that anyone does. And then Sculptra fillers can just be the want beyond that. So Sculptra is the need and fillers is the want. What to expect that day. Let me rewind for a second. So almost everyone is a candidate for Sculptra. Patients that I don't recommend have Sculptra are patients who have any sort of autoimmune disease. Sculptra, when it was initially launched 15 to 20 years ago, it was in a much smaller solution of water. So there had been some reports of post-inflammatory nodules, which means that, maybe 3, 6, 12 months after an injectable, patients can get almost an inflammatory response where your immune system is heightened and attacking, this particle or product that's in your face. And since that, and really it's just a knot of collagen, essentially. We can try to bust it up with some saline or break it down, but essentially what happened was they relaunched in a much higher solution of water to hopefully disperse those particles a little bit more effectively. So now we blend that particle in about 9 cc's of water. And that has been proven to yield better results with less risk of post-inflammatory nodules. So if patients do have a history of autoimmune disease, I don't typically recommend Sculptra, just because I'm not ready to take that risk, and I'm sure you're not either. And there's some gel fillers that I don't recommend in the same scenario. Outside of that, almost everyone is a candidate for Sculptra. You can't really overdo it with Sculptra. Again, it just gives that nice natural result over time. What to expect that day when you show up: we will clean and prep your face with an antimicrobial solution. We use something called a cannula here, which is a blunt tip needle, essentially. We make one little entry point, and then we really layer the Sculptra through the dermis in multiple different areas where we see volume loss. The following day, we do send you home with some homework. We expect that you need to massage your face for 5 minutes, 5 times a day for 5 days. So it's the rule of fives, 5, 5, 5. Your face is definitely tender after the procedure. Sculptra is lactic acid, so imagine a really difficult workout, your legs or thighs are really sore and you're trying to foam roll them. It's because of a buildup of lactic acid, and now we've just injected it all over your face. So your muscles are definitely a little bit tender, but not anything that's unmanageable. You can certainly take Advil or Tylenol if you need to. After that massage, you just forget it and just wait. For some patients, that can be a little bit frustrating, because I know that in this world and in this day and age, everyone wants to see immediate results, but this is not going to be the product for you if you want immediate results. This is going to give you that gradual, natural looking volume restoration. We will do your first massage for you to demonstrate how to do it at home. And there's always the risk of some bruising after injection. We do our best to try to avoid that, but ultimately it's out of our hands. You can ice if you need to. There's no heavy exercise that day. You can resume all your normal activities the following day. Outside of that, it's pretty straightforward, and if you've ever had dermal fillers, it's almost an identical procedure. If you guys have any more questions, feel free to call my office. You can email me. I'm happy to answer. Anyone who decides to book Sculptra until the end of the month will receive 20% off. So have a great day. Hey everyone. So we have a lot of great questions here that I'm going to try to go through and answer for you guys. So the first question is, can you use Sculptra to lift the jowls? So I don't love to use the word lift when it comes to Sculptra. Sculptra is definitely going to improve the appearance of jowls because, again, it's giving that global revolumization. And the reason why we get jowls in the first place is because we have ligaments that run from the corner of the nose to the corner of the mouth, from the corner of the mouth to the jawline. And as we start to lose fat, our fat pads under the skin start to disintegrate as we age. The skin no longer has support there. It has nothing to tack up onto. So from gravity, our skin starts to fall at a 45-degree angle, and that's when we start to see some jowling at the jawline. So if we give that volume back, that global volume back, we're restoring where the fat pads used to be. Naturally, we will definitely see an improvement in the jowling. Depending on the severity of the jowls, patients won't necessarily get a full correction of the jowling, because if we continue to just add more and more and more Sculptra to give a full correction, there could potentially be too much fullness. So I would still stand by that 1 vial per decade rule as a whole. And then whatever correction we get, which again, I would anticipate a significant improvement in the jowls, just depending on the severity, whether or not you would get complete resolution. The next question I got was, does it add fullness upon injection? Definitely. So we are essentially flooding the face with about 20 cc's of water on that first and second visit. So your face definitely looks full the first day when you leave, and then the following day it also is still pretty full until that water absorbs. and then it's gone. So that's the one thing that I really try to educate patients, because the first 2 days, sometimes people really like that fullness because every line that they've seen in their face is completely resolved. It it's gone. But then when the water absorbs, you're back to your baseline. You look like you had nothing done at all. And that's why I say this is a very gradual, natural process. And I encourage patients to take pictures of themselves before and then every 4 weeks, because when you're seeing yourself day to day, you forget where you started. So, yes, you have fullness the first day, you have fullness the second day, and then it's as if nothing happened at all. The next question is, will Sculptra address marionette lines? I think you can probably see from that before and after that Sculptra demonstration, because you're getting that global revolumization, you definitely have an improvement with any deeper line in the face, including marionette lines. I will typically, there's certain areas where you don't necessarily want to inject Sculptra. And one of them is where you have a lot of movement. So like directly over muscle in the orbicularis muscle, which is around the mouth. It's like a donut. I won't inject Sculptra directly over that because there's too much animation there. And I don't want those particles to gather together and run the risk of potentially developing a nodule down the road. So I come below that orbicularis muscle, which will help soften the marionette lines as well. Can it be used in the neck and jawline? Yes, Sculptra can be used anywhere on the body. Some patients will use it in their décolleté, use it in the neck, because it really helps improve the integrity of the dermis. So crepey skin, skin with poor elasticity, lax skin, it's definitely going to help improve the overall quality of the skin. Again, I wouldn't say that it's going to lift the neck, and it may need to be used in combination with other therapies such as radiofrequency microneedling, where you get that thermal injury, mechanical injury, in addition to that PLLA, that lactic acid. So it helps improve the overall quality of the neck for sure. And jawline as well. If we're just addressing the neck, we would definitely come up onto the jawline. If you're doing your face, I wouldn't specifically just do your jawline, because you could potentially widen mandible to mandible, which is not a desired aesthetic look. Would COVID-19 boosters affect the Sculptra since the vaccines crank up the immune response through the body? Yes, definitely. So same as dermal fillers, hyaluronic acid dermal fillers. What we found out shortly after COVID vaccines were launched was that patients who had dermal fillers within a 2-week window, either before or after the COVID virus or vaccination, a percentage of those patients were getting a post-inflammatory response. Now, what we tell patients, guidelines say to wait 2 weeks before or after the COVID vaccine before receiving any sort of dermal filler. And I would put Sculptra into that category. In this office, we actually prefer to wait 4 weeks on either end just to be safe. It's not urgent to get Sculptra, and there's no reason to take a chance. How long should you wait if you have other fillers in? You actually don't have to wait. Some patients will get Sculptra and they'll have fillers on the same day, which is totally fine. If you want to use fillers to kind of fill in whatever Sculptra didn't necessarily capture, then I would wait the 6 months and see where those deficits are. And then we can use filler to give any additional want that you may potentially need. If patients tend to have a fair amount of filler in their face and you're looking to see that kind of come down before you add something like Sculptra, you could also wait 6 months. What I tell people is, regardless of what is happening in the aging process, what we know about Sculptra now, as far as helping with the deep layers of the muscle, helping with bone reabsorption, and then obviously helping with global revolumization, everyone can use Sculptra. you can't overdo it with Sculptra. So even if you have fillers in your face, by the time the Sculptra starts to kick up and work, the fillers are really disintegrating and metabolizing and breaking down. Have you tried this on areas other than the face? Yes. So as I said before, definitely décolleté. People use it on the backs of their arms, above their knees, anywhere that where you have that crepey textural changes in the skin. Sculptra is going to have a big benefit. Can you have Sculptra if you currently have filler? I just answered that. Yes, you definitely can. The one thing that I'll also tell patients is when you leave the office, your end result 6 months after treatment should be 50% of what you look like that day. So once that you see yourself that day, the water absorbs the following 24 to 48 hours. We would expect 6 months later for your end result to be 50% of what it was at your maximum fullness. I personally have 4 vials of Sculptra in my face. The first thing I noticed was definitely that glow in the dermis, and my first treatment was in May. So I'm just about 3 months out, 3.5 months out, and I just had my second treatment in August. So I really haven't seen the maximum efficacy of any of this yet. Is it possible to begin slow with the Sculptra and start with less vials than 1 per decade? Yes, it is possible to do that. I would not start with, I would definitely do 2 at that initial sitting. I wouldn't do less than 2, and you could potentially wait 6 months and add another 2 after that. However, I find that when patients try to start slow, they're setting themselves up for disappointment because you are not, it's like going to the doctor for high blood pressure and only starting on 1/4 of the blood pressure medication. It's not going to be successful. When you look at an Advil bottle, it says take 2 tabs every 4 to 6 hours. If you took, and that's what is FDA approved as on-label efficacy for that dose, right? We know that that's the dose that's going to work regardless of how much you weigh, aside from pediatric dosage, which ends at 12 years old. But we know that that dose is what's going to work regardless of how tall you are, how much you weigh, if you're a male, if you're a female. And it's very similar to injectables as well. All the studies that were part of clinical trials and got FDA clearance showed, obviously, for a full correction, 1 vial per decade. So I would always recommend aiming for a full correction. You could start with 2, wait 6 months and add another 2, but I would say that you're really not going to see anything, which at that point, patients don't think that it works, when the reality is they never were at the proper dosing to start with. And I think that is the last question. So if you guys think of anything else, definitely you can send me an email. You can text the office. You can call me. I'm happy to chat with you over the phone, or you can come in for a complimentary consultation and we can make recommendations based on what we see when we see you in person. I hope you guys all have a great day, and thanks so much for joining.